My name is Jason Harjo. This is my job analysis for a child and adolescent counselor. As we go through this video, we will address the following: the core tasks of the specific type of counselor. We will examine the cognitive and physical and environmental demands of this occupation. We will evaluate the risks for human error, and as we evaluate that, we will then provide recommendations on how to improve on these errors and mediate any sort of problem. So, according to the National Association of Social Workers and the Society of Clinical Child and Adolescent Psychology, a child and adolescent counselor is a counselor which focuses on younger clients, obviously children and adolescents, that are experiencing behavioral, emotional, or developmental challenges. They will work directly with their client or caregiver using documentation and decision making to develop strategies to help them in their lives and overcome these challenges. The main tasks that are specific to this occupation are conducting intake assessments when their client arrives, provide individual counseling sessions for each of their clients that they are seeing, develop and implement strategy plans to help them overcome various challenges, and help their clients in crisis situations, whether that be their client, their families, or their caregiver. Here on this task analysis table, we have it broken down into some more steps. When it comes to the intake assessment, it is important to gather their history and interview the child and assess any symptoms while actively listen to them, make sure intake forms are done well, and try to mitigate any missing information from that. For the sessions themselves, building a rapport and guiding the discussion, coming up with ideas and applying different techniques for their client. It is important to have, for a counselor, to have high emotional intelligence and to have a disciplined attention to be there with their client in that moment, which requires an office space and various materials, but there can be some risks here in just a lot of emotional fatigue. Coming up with treatment plans would be setting goals and monitoring your client's progress over time, making sure you have the clinical knowledge and correct decision making for this as well. You can have software that can help with planning out different things. Uh, However, if goals are poorly set, then that can fall flat. It is important to assess your client's risk and make sure that they are safe in every moment, making sure you have good, rapid decision making under stress, especially. It's important to have emergency contacts for your client in case things aren't going how they should. So, when it comes to these four areas and human factors, each of these have concerns. Physical strain from sitting or fatigue are some of the physical ergonomics that we have to think about. Cognitive demands is a high workload and sustained attention in very intense emotional sessions leads to a lot of cognitive effort being poured in. For emotional demands, we have to look at a lot of counselors who face burnout from the constant exposure to trauma can take a toll on a person over time. And lastly, the noise level and the location of the therapy can be distracting and making sure you have the proper time for each client. Some recommendations are having a good office with comfortable seating, making sure the office has a good layout. If a counselor can use digital tools and good note taking to help with their attention, making sure that the counselor is getting their own help will play a major role in helping feel less burnt out. And being sure to have plenty of time for your clients by scheduling breaks between clients to decompress, as well as having the office in a very quiet area and making sure the environment is suiting your client and you. These were the citations used during this job analysis. Thank you.